It's 8:30, and we'll call the meeting of October 3rd to order. Before I take any comments, I would just like to make sure everybody is aware that there is now a sign-up sheet for the public to put their names on, so that they can be their names can be put into the minutes, and everybody will know who was here. We'll start with public comment. Representative Babson.
Thank you, Madam Chairman. Madam Chairman, I have several comments here. The first one has to do with the minutes. You want to take that up now, or
Sure.
will you include the minutes, public in the minutes when you get there?
No, I just assumed you took it up now.
You've taken out the who's here from the public, except we have that now. You've taken out public comment, except if it's important, but I think it's just as important if you decide to put them in the minutes, as you have this week, that you put the person's name in that asked the question, so that there's some historical record. Public asked the question why Robin sent out the August budget policy in the non-public. Public asked the question, why isn't Bonnet, Page and Stone our general contractor, and so forth. I think that ought to be, in my case, it was Mr. Babson, but it could very well be somebody else. I think it ought to be in the minutes.
Okay.
In fact, it's a lot less letters if you're worried about the cost to put Babson than the public asked. The waiting list, are we going to discuss Mr. Chandler's waiting list priorities today?
I would love to do that. However, as you are well aware, I was not here on previous week, and I have requested a copy of that waiting list information. What I listened to on the record, on the tape of the meeting, I had a lot of questions and comments to make with regard to that list. But again, not having it before me, I'm a little bit out of touch with what actually it says.
The only reason I asked, Madam Chairman, is the chairman last week said we'd be discussing it this week.
I know he did.
The public comments would be included in that part of the discussion.
I know he did, and as I said, I don't want to repeat myself, but I would prefer if I had an opportunity to look at it before I make a comment on it.
Okay.
You are decidedly ahead of me on that case.
Thank you. And the last comment is, is Mr. Murray coming in today? No, he isn't.
No, he's not.
Where are we on the four thermostats that have to be moved? It would appear to me that, as I said last week, I don't believe that we came in and said, gee, that would be a nice place for one, and that would be, someone had to say where they went, and if it was the architect, I certainly believe that they ought to foot the cost for moving them.
I believe, I can understand your theory, and your rationale. I believe, though, that there was, I believe Mr. Commissioner Sorensen explained that there was a contingency fund for just this kind of purpose. However, whether or not the contingency fund is still there was something I didn't. I have to look into to see if that is the case. I will, though, speak with Mr. Murray about whether or not they have been moved and what the ramifications of that move has cost us.
Well, Madam Chairman, my understanding of a contingency fund goes something like this. There's money set aside. If during the process of building, we decide that we don't want to put down Formica cabinet tops and we want to put down maple tops, and that's going to be an increased cost of $2,000. That comes out of the contingency fund. Anybody that would pay to have these things moved out of the contingency fund, I think, isn't thinking straight. We didn't decide to put them there. Somebody else told us to put them there, and it isn't working, and why are we going to take more of our own money to move them when they are responsible for telling us where to put them? Unless they're not in the right place.
That's right. I'm not an engineer, and so I cannot debate this problem. However, I would think that if they were scheduled to be, or they were on the plans to be put in a certain spot, and it turns out that didn't work properly, I don't know who is at fault in something like that, and perhaps fault isn't what we should be looking at now.
Well, my guess is it isn't the taxpayers of Carroll County that are in the wrong.
I
It
don't
had to
know.
have been the.
I don't know that there's anybody in the wrong. I think that makes an assumption that we cannot make.
Well, I make it. Thank you.
Anybody else? Okay, not seeing any other public input. We can go on to the next thing, the reviewing of the previous minutes. I'd like to make a statement here regarding minutes. It has been a bone of contention for some time now regarding the minutes and how they are, how the length of them and the process that we have gone through trying to make them somewhat more concise. What I did on these minutes this week is I completely rewrote them. And I will be glad to read what I thought should be the way the minutes would read. It is certainly up to the clerk to make that decision. You all should have before you a copy of the minutes for today. Notwithstanding what Representative Babson says about putting the comments of people from the public in, I did not do that, but that's certainly open for conversation, because I looked back for the last 4 years, 2008, minutes of 2008, and from that point in time, it is quite true that the public's participation was noted in the minutes. One sentence, and that was all. Since we had gotten away from that because in our efforts to shorten the minutes, I did not include the public's input, but certainly if the clerk feels that that's necessary, we can see how that can be done with some clarity. Anyway, going down to Commissioner Sorensen called the meeting to order at 8:30 a.m. Full public comments can be seen at. And response to public input. Commissioner Sorensen, regarding the hiring of a county administrator, the commissioners will discuss the proposal once other business is taken care of. We will have to bring it before the delegation for next year's budget. Though we have authority to hire, we must have money in the budget. Commissioner Sorensen, regarding the waiting list at the nursing home, we will wait until Mr. Chandler comes before us to discuss this item. Commissioner Sorensen, regarding the question introduced about missing file, I have answered that already. The file has been found. There was a $2,000 settlement. I signed the papers in November of 2011, and at the advice of Primex Insurance and attorneys, that is all the information that can be given out. Commissioner Sorensen, regarding the question about a $5.14 million budget increase, $2.5 million of the surplus money was used towards reducing the amount to be raised by taxes. In 2012, the rate of the increase was 2.87%. Because of the payment of the nursing home for the nursing home and a tremendous DEAS increase of $300,000. Helping to keep the amount to 2.87% figure was the added revenue from the nursing home. We will do some more research on how much revenue and how much was
Point of
surplus.
order. Commissioner Solomon, I want to remind you that you were absent when these minutes were taken. You were not there, so I believe you're going to abstain. And Commissioner Sorensen is not here, so I was going to table these minutes anyway. So do you want to go further and read the two sets of minutes? This minutes and your minutes?
Well, do you have any objection to them?
I just want to tell you I'm going to table them.
I understand that.
We
I know that.
We cannot approve
I
it.
am perfectly aware that you're going to do
okay.
that. But my question remains.
Because you were not even here, and you want to try to change a lot of things and
Well-
take stuff out. but you were not even here, so you're not going to even vote on it.
I understand.
You're going to be abstained. Okay, so I just want to know that you're aware of it.
I am quite aware of where I was.
Oh, okay.
I watched it on the video, though.
Yeah, okay.
Can I go on? Or do you want to just...
You can go on, but
Okay,
you
fine.
were
Thank
not
you.
at the
Thank you.
meeting. So if you want to go on, go on.
Thank you. The meeting goes to agenda. Will DeWitt Farm report on file in Commissioner's office, but I think that one item should be, from what I saw on the tape, he is looking to put in speed bumps, and we'll get some estimates. I think that should be noted. Howard Chandler, interim administrator, report on suggested wait list recommendations on file in Commissioner's office. By the way, it is not. Survey completed last Thursday. There were 6 to 8 surveyors at the home for 3 days. The Mountain View community did exceedingly well. The census today is 102 residents. There is a concern regarding the MDS proposal brought forth last week. The issue has become acute. The current acting MDS coordinator will be leaving on family medical leave. Though the position has been advertised, there have been no qualified responses yet. Perhaps we can get someone temporarily working nights, or maybe someone just to do the data entry work. Commissioner Sorensen says he will speak with Human Resources to see if there are any qualified applicants, possibly hire some full-time instead of having a consultant come in. We tried a consultant and it proved costly. The commissioners will look into the direction that he will take. Motion, Commissioner Sorensen makes a motion to approve September 19th, 2012 public minutes to be as corrected, seconded by Commissioner Kenney. All in favor, motion passed. Commissioner Kenney states that she disagrees with Commissioner Solomon's assertions that she, Kenney, made unsubstantiated statements. Motion, Commissioner Sorensen makes a motion to release October 12, 2011 non-public meeting minutes, seconded by Commissioner Kenney. All in favor, motion passed. Motion, Commissioner Kenney makes a motion to release September 14, 2011 non-public minutes, seconded by Commissioner, Commissioner, that's an error, Sorensen. All in favor, motion passed. Commissioner Sorensen makes a motion to release August 3rd, 2011 non-public minutes, seconded by Commissioner Sorensen. All in favor, motion passed. Bob Murray, Safety Committee, on proposed locked door policy. Bob and members of the Safety Committee are recommending a locked car policy, so there is no opportunity for an escaping inmate or one released from jail to break into a vehicle and drive away or steal the contents in the vehicle. In the best interest of employees, nursing home residents, visitors in the entire county, that there be a locked car policy in place. Commissioner Kenney asked whether counties have such a policy. Bob responded that Grafton County has such a policy and written warning for corrective action, suspension, and then termination. Commissioner Sorensen opposes such enforcement but would recommend posting signs to lock their vehicles. Human Resource Director Janice Sullivan, also on the committee, will review the submitted written proposal policy and have a discussion with the commissioners. Regarding Bob Murray, regarding the carpet. Bob proposed taking a settlement on the carpet in the main room of the nursing home. Though it is still not perfect, with furniture down, the imperfection in design is not noticeable. Responding to Commissioner Kenney's question, the carpet has been replaced 3 times and the pattern is still incorrect. Rather than replacing it again, perhaps we can get a settlement of $8,000 to $10,000. Commissioner Sorensen suggests getting the cost of the carpet before deciding on a settlement amount. Commissioner Kenney asked the cost of moving 4 thermostats and who made the mistake in placement. Bob responds the cost is $900 and agrees the charge for moving should not be charged back to the county. However, the money should have come from the contingency fund, but that may no longer be possible. Motion, Commissioner Sorensen makes a motion to go in non-public session at 10:03 for personnel and contract, seconded by Commissioner Kenney. Roll call, all in favor, motion passed. End of minutes. I have no personal, well, I have a personal interest that it be, that we do something about the minutes and to make them more cogent and more, and clearer and shorter. This is a suggestion. If Commissioner Kenney does not feel that suggestion works, perhaps she can make some further suggestions next week. I understand that she wishes to table this, and certainly I can understand that. Okay?
Yeah, I just want to have a little comment. You can write minutes different ways. I think every time if we have another minute taker, they will write it their way. That is how they perceive it. You want to have the minutes precisely your way. Like I said, you can write it 3 different ways. It is about that the content is correct and the minutes are accurate. The way everyone is going to write it, if I will write it, it will be different. You write it, it will be different. She write it, it will be different. We give on giving every time different signals how we're going to do it.
Well, that's why I propose...
So what do you want now? You want a public input. What I see what you did, you take almost everything out, what the commissioners are answered. So you don't want to have that in, or you want to have it shorter, 1 sentence?
Yes.
And it is only, remember, we had in the past minutes who were 10 pages and longer. This is only like
No, that's in the
2.5.
recent past, not in the past from 2008 to 2010.
Okay, I'm not talking about 2008
I am.
and 10.
I am.
Talking about 2011.
Well, it seems to have
Was
gotten
much
out of
longer.
hand at that point.
So, do you have a sample from you think 2008?
Yes, I
Is-
have them
Oh,
downstairs.
if you have a sample from
I've
her?
shown them to you.
If you have a sample, so I can show her. If
Fine.
you maybe want to change
Ex-
a couple things, and then I will talk to her.
Okay, thank you. Jason?
Morning, Commissioners.
Morning.
This morning we have 45 in-house, 0 weekenders, 0 on electronic monitoring, 9 transfers, 5 out on pretrial release for a total population of 59. Last week we admitted 9 inmates, 7 were repeaters, and released 15 of them. The repeated charges, 1 came in on an admin transfer from Belknap County, booked 2 times in 2 years. 1 for a capias, booked 5 times in 3 years. 1 for a warrant in protective custody, booked 9 times in 19 years. 1 for criminal mischief and criminal threatening, booked 3 times in 6 years. 1 for a warrant, booked 2 times in 3 years. 1 for a fugitive from justice, booked 3 times in 17 years. 1 for simple assault, false imprisonment, and criminal threatening, booked 4 times in 5 years. We had to ship an inmate down to Stratford County due to housing conflicts. Again, we took that one in from Belknap County on administrative transfer. And yesterday, I had a quick discussion with Bob Murray and Jerry in regards to developing countywide service contracts for the complex where we're going into the budget. Just thought that might be beneficial to have one vendor for the entire complex rather than having multiple vendors. We already use similar vendors, but I think we have separate contracts because they all expire at different times. So try to want to bring some uniformity to that. So we're going to have a meeting today at noon time to discuss the likelihood of that happening.
Good.
And that's all I have.
Okay. I had a couple of questions, but as you were reading, something else came to mind.
Mm-hmm.
I don't know if this is possible, and I don't want to give you any further work. It's, if you don't know, then don't bother doing it. But the repeaters,
Mm-hmm.
do they come in for similar problems?
Crimes?
Yeah, similar crimes.
That I'd have to go back and
Yeah, I-
really
yeah.
research.
It was just a question, just
Mhm.
wondering if they just keep doing the same thing over and over again. How's the panel coming along? What was the date of that?
October 26th at 1 o'clock. It's a Friday.
October 26th.
I have to reach out to Lance. I asked Lieutenant Phillips if he had the contact information, and he didn't, so I just have to
Oh.
go through
He's o-
Tri-County cap.
Yeah, he's over at Tri-County Cap. I would have done that for you yesterday when I was there, I just forgot. I didn't forget, wasn't aware you needed it. And the others are all on board?
Yes.
Good.
Mhm.
With regard to the fence that we were talking about some weeks ago,
Mhm.
anything further on that?
Told to budget for that for next year.
Oh, you have put it
Yeah,
in,
I'll
putting
put
it
it
in
in
the
for
budget?
this coming year's budget. Yes, ma'am.
Commissioner Kenney, do you have any questions?
Yeah, no, thank you.
Okay,
Thank you very much.
thank you.
What an easy one.
Yeah.
Couple of things we have to take care of. We have some forms here, Commissioner Kenney.
What?
We have some forms here.
For what?
Forms.
Mm-hmm.
And
Forms for what?
for Hale's location.
Oh, okay.
If you could just, this is a inventory evaluation, has to be signed right next to your name.
How many signatures are required?
Two.
Just two? Okay.
Just for your information, so you can look at that. There's a new building going up, new house going up.
Did you bring in the non-public meetings from last week? You scooped them. Don't worry about that. Better know, right?
And 3 checks.
Okay. This is only one signature, huh?
Yes.
That's yours, okay.
Thank you. I see Mr. Chandler has come, so would you please come up?
Good morning, Commissioners.
Good morning.
Good morning.
Before I forget, Commissioner Kenney, there are the little copy of last week's.
Oh, okay, thank you.
We'll have for your minutes.
Do you have a copy of the policy that you
I do, in fact, I have a revised one, I have the version 1 from last week, but I also have an updated version.
Both of them, if you don't mind, because I wasn't here, so.
Yeah, I can. Actually, the old one and the new one. Oh, the old one. Let me do a clean copy of the old one. Because I've made some provisions based on input. That would be an old one and a new one. So this would be a revised one. But I have a couple of things for you to.
Point of order, Madam Chairman?
Yes.
Does Mr. Chandler have a copy for the public?
I do, and with your permission, I'd be glad to distribute them. You gotta guess what side if you want one. Things that I do have for you by way of update is that as of today, we have just want to confirm the census is at 100 with 2 admissions coming in tomorrow, so we're functionally full. So that is tracking very favorably. You did receive a communication from Becky Mason, Director of Nursing, relative to the MDS coordinator situation. I'm glad to report that as of 10 minutes ago, it looks to be that the situation is under control.
Oh.
We do have somebody coming in Friday, and it doesn't appear at this time that there'll be any lost revenue or lost recapture, so that we are lucky. It's a little close. It's somewhat of a close call, and speaks to the nature of what we need to do to have some redundancy built in. We are advertising for a new MDS coordinator, and hopefully within a month or so, we'll then be back to having 2 people able to do the work. So that's looking better.
Was there not, I thought there were 2 people who had sent in their resumes for the administrator's job, but were really not administrator's job, they were really coordinator's jobs. Is that not so?
Well, I do know there have been at least 2 applications received by Human Resources Department for the MDS coordinator position.
Oh, okay.
I don't know what the status of that hiring is right now. But I do know that it is underway. This was complicated by the temporary, the permanent MDS coordinator left.
Yes.
It's been filled by a temporary position,
Yes.
and she's now out for about 2 weeks on family medical leave.
I'm aware.
So that's left us a little bit short. Have been looking, and I believe that long-term, we can actually create more depth. We actually have other people who are familiar with the system and could step in on a temporary basis with a little bit more support and a little bit more training.
Even the updated MDS?
Even with the updated, at least to get the submission, so there's a difference between doing it and submitting it. The submitting part's the critical part to getting reimbursed.
Mhm.
So that I think we could get through the critical points with no added expense and just a little bit of extra training.
And you said that somebody is now doing it on some interim basis?
On an interim basis, it'd be Axelrod Associates or
Oh, okay,
Axelrod
then.
Consulting. They'll be actually in on Friday, and that will be within the time frame that we need, that we're not going to miss any deadlines or lose any opportunity. But it was real tight. We weren't sure that we were going to have
Yes.
somebody even on Friday. And apparently, if we go more than a week, there's a chance of submitting late and not going without total revenue, but not maximizing the revenues.
And this person is able to do?
To do everything. Actually, this person is actually a consultant who actually trains people to do this.
Oh, okay.
So we're paying a premium. It'll still be revenue, it'll still be expense neutral in that the lack of expense of somebody being out is greater than
Covers
the
that.
cost of somebody coming in. So we'll be paying more on an hourly basis, but the total expense will be much less.
Mhm. Okay.
Other things brought up 2 weeks ago was resident lift, and just an update on that. I'm getting 3 bids on that, have met with 1 vendor, and hope within 1 week or 2 weeks to be able to come back to you with a recommendation for purchase based on at least 3 competing bids.
And but you do have what you need for the present time?
We do, minimally. We actually borrowed 1 lift from physical therapy to be able to use in a resident room. But it leaves us with no capacity. And talked briefly to HR last week in terms of our real exposure as a county, as an organization, and as an employer, is staff members getting injured, and potentially residents getting injured too. And our ability to have the lifts keeps everybody safe. Ultimately would hopefully reduce our workers' comp experience modification and our workers' compensation insurance bill. So it's one of those wonderful things. We're doing the right thing, helps everybody and saves money at the same time. So I see the lifts as being, now actually, in looking at an option where we might be able to actually be able to get refurbished lifts with a new unit guarantee. One of the providers just replaced and upgraded a number of lifts with Peter Brent Brigham Hospital in Boston, and so there's an opportunity that we might be able to get refurbished lifts at half cost, which allow us either to get more.
Are they warranted?
As the same as new, and they look the same as new, and which could be perfect for the relatively light use that we give them.
Good.
So that'll be an option that'll be coming up. Have a point of clarification for you. Question came up last week, and there was some confusion about how the county gets reimbursed for let's say, a county resident who's in the Belknap County home or vice versa. And we're all a little confused, and as I found out, understandably so, and thanks to Kathy Gary in the finance office, who found the memorandum of understanding between the New Hampshire counties and the State Department of Health and Human Services in July of 2008, everything changed. So those of us who are remembering before 2008 and those after 2008, what happened in 2008 and what was entered into by Carroll County along with the other 9 counties is that rather than each county hiring staff to do all this billing and back billing and accounting, that it would be addressed by formula from that point on. So the reason for confusion is that everybody was right, but the good news is, because I think that was the memorandum of understanding simplified things considerably, is if a Carroll County resident is for whatever reason in another county's nursing home, we do not get billed. Carroll County does not get billed for that. Nor do we bill Belknap County if we have one of their residents there. So, but I do have that memorandum of understanding, thanks to Kathy Gary, if anybody needs more clarification on that. The next item I have for you is administrator appointment. Just as a reminder that it's been now over a month since you've had a full-time administrator. And if you acted today, it would still be at least 2 weeks before you would have a full-time administrator. And at the end of October, your agreement for interim services ends, and you also open yourself up to questions of non-compliance with Health and Human Services for not having had a full-time administrator for 2 months. So there is a bit of jeopardy involved. So apart from that end, and would also note that the lack of a full-time presence creates a burden on staff, specifically on Becky Mason, the Director of Nursing Services, who has already been shouldering more than her share. So it's especially difficult on her, but also it also complicates any other management of personnel issues that are going on, because there isn't anybody that can cross department lines effectively. So it will have an increasingly negative effect on morale for want of having that full-time presence. It creates a vacuum, and vacuums seldom attract anything that's good. It creates problems. It doesn't create opportunity. So,
but you do understand that nothing can be done today. We absolutely have to wait until next week.
oh no,
until we have a full board.
that's clearly up to you. But I'm thinking that it's you don't want to continue. I'd encourage you not to defer any longer than you absolutely have to.
I understand that.
Because you're also getting from an administrative perspective, you're getting in. This is budget time, and you really need
Absolutely.
budgets need to be done well, and you can't do that without having somebody there, but remember, any decision you make is going to be delayed by at least 2 weeks in any case, so time is getting to be, time is of the essence. And that brings us that if you're willing, I know that I just distributed it, but a revised version of the admission policy. I added a cover letter. I did, what's included in this version too is I added 2 notable things. One was to address the issue raised by Commissioner Sorensen on how we deal with urgent matters that wasn't addressed in the first version, and also one that I neglected to include, which was where Medicare would be included in all that. So what we really have, starting on page 3, is some 14 different categories of admission. The goal being so that people can have confidence in the admission process, so that the commissioners can have oversight and control over what goes on, yet at the same time allowing the administrative discretion within categories. So as proposed, the administrator would have the right within a given category based on urgency to put someone at the head of the list, but not to jump between categories, which would that would be reserved specifically for the commissioners, which I think creates a good balance of, it's my bias of course, but keeps you involved, informed, and essentially in control without holding up a process where an empty bed costs everybody money and delays somebody's admission.
Also micromanaging.
Well, but there needs to be oversight, and I think as long as you have control, and there's a point where you ask for permission, and a point where you give information. I want to be sure that the commissioners are involved, because your knowledge and your awareness and support is critical. But I think this strikes a balance. What I've been hearing from many people is that it's the lack of policy creates a concern, because the lack of a easily to understand policy leaves some people thinking that it's a policy that can be manipulated. The absence of the policy, creates confusion and lack of trust.
Frankly, this has never been a problem.
Wonderful,
before.
Madam Chairman.
Yes, sir.
I thought that I heard you say a little while ago, we weren't going to discuss this week until Mr. Sorensen was back, until you had a
Yes.
chance to look at it.
You're right.
I think we're discussing it, aren't we?
Well, yes. I
I
just,
personally would like time to read it and
given that,
then
that's,
come back and ask Mr. Chandler questions and understand what he's saying. I can't do it without knowing what's going on here.
I would just like to get his understanding of what he's written, and then we will deal with this at another time.
Okay?
Because I have several comments to make as well, but I will hold those until some other, till another time.
And those are the notable changes from version 1 to version 2 that I don't put it before you for consideration at this time, but just so that if you are comparing versions, those are the essential changes from last week to this week.
And may I just ask, did you come up with this from your experience, or did you come up with this because some other counties use similar processes?
I didn't solicit other counties, so I don't know what they're doing. My experience at Belknap County would show that they had an equally informal policy that worked for the better part. Now, I don't know if that's currently in place, so that information is about 4 years dated. So this is created by me based on what I sensed your needs and in talking with staff, what they were seeing the opportunities. So this is as far as I know would be unique to Carroll County. It's not unique to retirement communities. There's oftentimes in the not-for-profit world, we'll build in preference by geography. There's a local community that's providing oftentimes a property tax break to a community. Those residents deserve extra consideration, and so it's built upon a typical model used by not-for-profits. It is expanded a bit because here you have multiple payer sources. You have Medicare, Medicaid, and private pay. And so, ordinarily the list would be about 6 long, but when you add in those 3 different payer categories, it does extend it a bit.
Okay, thank you. And we will put this aside until
That's,
everyone has
yeah,
it.
there's no
Oh,
immediate
may I
action
have,
needed.
make sure you have a copy here for this Commissioner Sorensen.
And why don't I leave another for minutes and another for this one.
All right.
And that's, I'm gonna check, but I believe that's all I have of a specific nature. So open certainly to any questions or concerns you
You
might
have a
have.
point of order there, Ms.?
Well, it's a question while Howard's here.
And the question is?
The question is, you said that this would replace sort of an informal policy that was difficult to understand. I remember some of the people from the nursing home trying to explain it, the former policy to us, and or the current policy that that we operated under in the past, and it was very difficult to understand. It had something to do with acuity. Could you just explain what we're using now as our criteria?
Well, what we're using now is not written, at least I'm not able to find a written documentation. It's pretty much a common sense approach, giving preference to county residents, but also giving preference within that if somebody is in a critical situation where they don't have any other fallback position, that they would have preference over somebody who had the luxury of time, for whom it was not an urgent.
I'm not sure that that's what we were referring to as acuity, but rather the idea that the room had to be the kind of placement that would be good for that particular resident.
And that's true too. Now that you have designated units for Alzheimer's and memory support, and you also have bariatric rooms, and you also have rooms for couples,
Exactly.
which, if not used for couples, need to be same gender. Not really acuity, but and that
There's a
of course,
variation.
and that's I think is where my understanding has led to some of the concern on the part of others. Well, I know there's a room, and why can't I get in?
Mhm.
Well, it's because if you don't have a memory issue, or if you do have a memory issue, you have to be appropriate to the neighborhood,
placement.
where it is.
Exactly.
And I've tried to address that in the policy, to realize that there will be times that there'll be an empty room, and a county resident won't be eligible for it based on their needs, their gender, their, in some cases, even if somebody were bariatric, if somebody were very heavy, it would not be safe to put them into a room for which it didn't have the proper equipment.
Mhm.
So even though they might be next on the list, there might not be the appropriate
It's
room
not,
for
doesn't,
them.
the fit doesn't make it,
Exactly.
precisely. Anything else?
That's all that I have.
Commissioner Kenney, do you have any questions?
No questions, thank you.
Thank you.
Thank you very much.
As we are waiting for Janice, would you be able to do me a favor on your way out?
Send Janice on down?
Tell Janice we're ready.
I'd be glad to.
Thank you. And since we have a few minutes, I just thought I'd throw in this meetings that I attended. On Thursday, there was a meeting at Tri-County Cap Building to dedicate the new bus service. Many notables were there, DOS, Chair, Commissioner from DOS. Ray Burton was there. A gentleman from another bus service, C&J, was there, and various other people in attendance. And it was a very interesting, good, there were some interesting things that were said regarding bus services in general. The service that the Blue Loon is operating was being dedicated, and it was very, very positive. There were some things that we could they thought could be done on the state level to help all bus services. Yesterday, there was a meeting for the Blue Loon, and followed that for the RCC meeting. And among the people who were at that meeting was Damon did attend and look forward to his report in the newspaper on that meeting as well. But they went over the bus schedules, bus routes, signage, and then the grant money from the on the RCC level, grant money from the state for the program. So, and so, do you have any reports to make, Commissioner?
No. Oh, I just want to say, I want to table the minutes of September 26, 2012.
Okay. Are we up to date otherwise?
Yep.
And just in time.
Morning.
Morning. Morning.
Are you coming only for public, or are you coming for
Madam
non-public?
Chairman, did you
too?
take a vote on tabling them?
You're right. We do have to have a vote on tabling that, Commissioner.
Okay, I make a motion to table the minutes, September 26, 2012.
I'll second that motion. All in favor?
Yep.
Aye.
Aye.
So moved. Good morning. Good morning,
Morning.
Janice. Can you give us any sort of update on where we are with the CMS?
MDS?
MDS. It was just one letter short.
Mhm.
The MDS position.
Yes.
I know we have somebody coming in
we have
temporarily.
two qualified on paper.
Uh-huh.
One is internal.
Okay.
She is currently the backup.
Mhm.
However, she's also on family medical leave at the moment.
And how much longer, or how long, is this still out?
It's still out on the websites. The print ads have stopped at this point.
How long were the print ads out up for?
At least a month.
Wow. And-
Highly skilled, specialized positions.
Yes. And so we have basically one person outside of who we have now.
Yes.
Given that,
Mhm.
looks like we're going to have to do something critical.
Mhm.
So we should have, be ready to contact this. Could you contact her, that other person? I assume it's a she, but
Yes.
I'm just making an assumption. Could you contact, see if that person is still available and still interested?
Mhm.
And perhaps we can set up some sort of
Interview.
timetable to have her come in.
Okay. Will do.
Okay. Good, that takes care of that issue. Are there any other critical issues?
Not that I'm
going on?
aware of. No, we're conducting payroll training right now for Deb and I. We've got a woman from the ACS program out, and hopefully next will be Kronos, so we can finally
Oh,
do the
right.
interface
Yes.
together.
Are we going to get that all?
We are. I've
All
used it
settled?
before and I
Oh,
love it.
good. So
So,
you are familiar with it?
Yes.
Excellent.
yeah.
That would be very helpful to get that out of the way.
Yes.
Also, do you recognize you have to start preparing a budget?
Yes, I have started.
Oh, okay.
Mm-hmm.
All right. And keep in mind that we have to present the budget to the delegations.
Right. The one
Use a
glaring.
light pen?
I'm sorry?
A light pen?
Yes. Well, the one and only issue that I see right now is the advertising budget for
Yes.
positions, because we exhausted early on, having two high positions become vacant at the same time, so to get into the periodicals and the different trade magazines that we need to advertise, and those were very costly.
So let's, keeping that in mind, let's
Right.
make sure we put in enough this year,
Mhm.
should something come up that we're
Right.
not expecting.
Right.
One of the issues has been how we actually put out for
Mhm.
publication our needs.
Yep.
Everything else running smoothly?
Everything's going pretty well right now. The employee reference guide has been distributed to all department heads for their feedback and input, and hopefully we'll have a final draft to the commissioners by next week to review.
Are you working on a general policy?
Yes, that's what it is.
Okay. All right. Commissioner Kenney, do you have any questions?
Yeah, I have a question.
Yes.
Did you start, we're going to give a workshop on documentation?
I have not done that yet.
Okay,
I have not. But I do have the whole module
okay,
available, so.
good.
Oh, I'm glad that you brought that up,
Mhm.
because I did I did tell you about
Yes.
a gentleman who was ready to, or can
Team
do
building.
this. Yeah.
Yeah.
So perhaps put that
Mhm.
into your calculations.
Yeah.
So we,
Yeah, I can get with you on costs and.
yeah, I.
Actually, we've used them before?
No.
No.
No,
Okay.
he has been used by Memorial Hospital
Okay.
and the Mount Washington Valley the visiting nurse service.
Okay. If maybe you could just shoot me an email with his
Sure.
name, I'll find out
Absolutely.
what the cost
I think
would
I
be.
have it have the information downstairs, I'll give
Okay.
it to you. All right. Well then, that was fast, thank you very much.
Thank you.
Thank you.
Payroll training.
Commissioner Kenney, do you have anything that you wish to add?
No, I have no report today.
Okay, then. Do we have anything, we have no minutes? How about sealed minutes? Anything like that?
No, we don't have any today.
Do you know how many minutes are eligible to be unsealed yet?
At this time, nothing. I will review again the one from 2012. 2011, almost everything is on seal. Only thing what I have is a couple of 91A's requests. That's all.
All right, given that, we'll move to public input for the end. Yes?
In listening to your conversation regarding the lifts, I'm assuming you haven't given permission yet for him to purchase new ones?
No.
Or purchase them?
No.
How much longer are you going to wait?
He's going to be bringing us in some figures.
Okay. I mean, as you know, those are put in there, the lists were put in there to assist the
Yes.
clients and to hopefully decrease your worker compensation.
Absolutely.
I mean, that's a critical piece of equipment that needs to be in
Well,
that building.
I understand. My first question was, does he have enough at the moment? And his answer was yes, but it's temporary.
Well,
because
they
he's
also
borrowed
took
it.
one out of physical therapy,
Yes.
so
That's what I mean.
I just would hate to see you delay that and
Well,
have somebody get hurt in the interim.
You're absolutely right, but the question remains, we have to be presented with some figures. We haven't had that yet.
Well, he actually did present you figures the first time, but then he came up with refurbished ones,
Right.
which,
Well,
Okay.
he was asked to get at least three prices, I believe.
okay. Another question is, how are the commissioners' email addresses working downstairs? Are you guys getting your emails?
Questions to me?
No, it's to both of you.
Oh, okay. I sometimes have a hard time to get in, and you cannot read it from your home or from your phone, whatever. You physically have to be here in the office.
I thought
So
that was
if
the
you have-
point.
What?
I thought that was the point. You guys didn't want to do it at home.
Yeah, so, well, if you could access it from home. But the 91As, if you have that, if you can send a request maybe to the office, because if we are not coming in to read the emails, it stays there. I don't know why you asked, did you send any emails or something?
No, I
that
was
we
just
need to
asking
reply?
how he set up commissioner emails so you could get them here. I just wondered how that system was working for you.
Well, sometimes I'm locked out. It doesn't really work smoothly.
As of well, I wasn't here last week, but the week before, I went on, I opened it up, and Commissioner Kenney reviewed what was on board. But that was 2 weeks ago.
Okay.
I wrote a few emails today after the meeting.
And I just have one comment. A resident came to the Board of Selectmen in Effingham 2 weeks in a row complaining about the Blue Loon. I happened to be there the second time and gave him Jack Rose's information, but they're still not coming to Effingham. And I know that they're probably going to come around to all of the communities again and ask for funding, but Effingham, once again, is left out in the cold, and these are people that need transportation.
I'm entirely with you, but you're presenting this to the wrong board.
I'm just putting it out there for whoever listens. It's just really.
Under those conditions, I would invite you, and I will let you know when the next board meeting is, and you can come and tell them.
Well, yeah, but and I can do that, and I've talked to people, and it goes nowhere. I feel like I'm wasting my time. So if hopefully people are out there listening to this, Effingham is still left out there in the cold, and we have a considerable amount of people that really do need to get to medical appointments, and so that dial-a-ride, I mean, I was so excited as a welfare officer to.
And the dial-a-ride isn't working?
No, it isn't working.
I'll bring it.
I mean, I promised them on the conditions of what you guys told me, and they call me and say, we call the number and nobody comes, or they say they don't come to Effingham, or what are we going to do? So it makes me look like an idiot.
Yes.
So, thank you.
Anyone else? Yes, sir. Mr. Babson.
I've developed a laundry list since we started this hearing. I'd like to point out on the minutes that you tabled, and perhaps it could be added, because I think it's important. There was quite a discussion last week about this. It was going to be a non-public session. Pardon me?
You're talking about the list, the
locked
Locked
car
car,
policy
yeah.
was going to be a
Yes.
non-public session.
yes.
And I think for historical reasons, things like that ought to go into the minutes, so that if somebody comes along in 3 years and says, oh, well, they always go into non-public session over such and such, it's there in the record. As it turned out, it wasn't non-public material, and it should be noted I feel it should be noted in the minutes. I would like to suggest that someone get together with our IT person and discuss having a guest router put in here, so that we found down at the legislature, I guess about 3 years ago, they put in Wi-Fi through a whole legislative building. So we can sit there, if a question about a law comes up, you put it in your iPad, in 2 seconds you have the information, and you're not waiting till next week or guessing. I would think with all the capabilities we have around here, we ought to be able to have a Wi-Fi system in this room, so that if we wanted to look something up, we could. In fact, we could look up all minutes if we wanted to. Next, I thought there was some discussion here about at this Axelrod company and the last time they were here, and I guess what I got today is they're coming back.
Yes, obviously, but I think the discussion was one-person discussion. Neither Commissioner Kenney nor I have had any contact with Axelrod, and so the only one who was discussing it was Commissioner Sorensen, and he had some complaints. But apparently, I have frankly looked into this and have found absolutely no one out there to help. I've gotten in touch with Commissioner Tompis. I've gotten, and their office couldn't help me. I got in touch with, I tried to get in touch with somebody from Sunbridge. I called the man twice. He never got back to me. I spoke with my daughter-in-law, who's an attorney for a for-profit, not a nursing home, but a assisted living facility. Asked her about it. They don't have anyone. I went through the process trying to find. I went online I went through the process trying to find someone. I was led to someone else. They no longer in business. There was just nothing out there. So from my perspective, I couldn't find anybody.
But yet, Health and Human Services are telling us we have to have one within, what was it, 7 days?
I don't know if they're telling you have to have one. It's better for us to have one because we are trying to get money for the work that we do on Medicare.
And how does this person function that she's the one that gets us all this money, or he gets us all this money for Medicaid? Is it something that has to be done today, or is it a long-range planning process? Or?
It apparently, from my understanding, and I'm certainly not if I were that good, I would take the job. From what I understand is we have Janice working with our people who get some help. That is covered under Medicare, and that's what we're trying to get the funding for Medicare. That's what this person would be doing.
Well, I guess it comes down, my question is basically then is, why is Mr. Chandler pushing so hard for, in 7 days, we're losing money? Isn't this an ongoing process?
Oh, yeah, it does, but I don't know, but my guess is that you have to be timely in presenting your report if you want money.
Okay, thank you. Next question. Mr. Chandler came in and sort of rebuffed what we've heard for the last 5.5 years here, that residents from this county are paid for by this county if they're someplace else and vice versa. And he says that's not true.
There's presently a formula now.
And now, how does the formula work and how is it fair? What prevents us from having 3 people from Stratford County and Stratford County only having 1, and we're carrying the cost of the Carroll County taxpayer is carrying the cost of those hypothetical 2 extra people?
I'm afraid I can't answer you. I can only tell you that this was a memorandum of agreement between the counties and DEAS, and everybody seemed to have agreed to it.
Well, they may have agreed to it, but as a taxpayer, I'd like to know how it works. If it doesn't work well for us, I would certainly expect that you, as our representatives, would go to the county organization and say this doesn't work for us. But if we don't know how it works, how can we even decide whether it's good or bad?
From what I've learned from Kathy Gary, it seems to be working well.
And you suspect that Kathy Gary has a real good idea of how it's working countywide?
Absolutely.
Okay. Well, frankly, I'd like to ask you 2 commissioners to come back next week and report on how this thing works, or else have Mr. Chandler come in here and allow us to ask some questions.
Anything else on your laundry list?
Yes. Over the past 2 or 3 years, I've asked that the county put the budget, not the one sheet that goes to DRA, but the line item budget that we get as members of the delegation on the website. Quite some time it was, as I recall, you couldn't do it because part of the information is in one system and part of it was in another system, and they couldn't bring them together or whatever. But we were told with our new website that we would be able to do that. And when is that going to happen?
Well, certainly not before we get the budget done.
Well, I don't know, Commissioner, but I think we're working on last year's budget. That could go on.
Oh, is that what you want? I see.
I don't care which budget it is. I think the public has a right to know. I think Mr. Boyle was right, that we should be able to see how our money's being spent, and to send in a one-line item where it gives you the total figure for each breakdown, and that's it, doesn't tell the public anything, except they're spending a lot of money. And I'd like to know why we're not moving towards putting this thing on the website. That's what we were told as part of paying these people that we'd be able to do. I don't see it being done yet.
Anything else? I take it he's finished. Damon?
Back in August, there was some discussion about whether a vote took place, and on August 22nd, Asha said it didn't, and Dorothy, I think you said it did, and
I don't know what.
Babson said it did.
I don't know what you.
And this is regarding the Perry investigation, and whether or not, Janice Sullivan was going to do the investigation, or somebody from
Yeah,
Lakeville
she has
was
done
going to do
the.
it.
She's done the investigation.
Where the vote took place, I looked at the video, and it appeared that the vote took place outside of the time that Ed was filming. There was a discussion about who was going to do the investigation, but there's no vote.
I can't answer that. I don't remember. I can't. I honestly don't remember.
Okay.
Yes, sir.
Madam Chairman, I think, and I was the one that said I thought there was a vote taken too. I think Commissioner Sorensen came in the next week after Damon said it wasn't on the film, and we went back over the thing, and it appeared to be a vote, but it wasn't. I think someone said, well, how would you vote? And you said no, or Commissioner Kenney said no. I forget how it works.
Oh, wait a
But
minute.
it appeared to be a vote, but it wasn't, and I confused it as a vote,
Actually,
and somebody else
it was
did.
a vote. I believe there was a vote because I was very anxious to do something where we would use Janice's skills
Yes.
to that extent, and I do believe we did have a vote, but I don't know. I don't recall. I thought we absolutely did.
So did I.
I mean, maybe you had a vote, but it wasn't in public, right? Is that possible?
Everything
think
what
so.
happened was non-public session. And what actually happened, I think we had Mr. He on here, and we were going to interview him in non-public if he was going to do the Perry investigation. And we went into non-public on, I think, the 22nd of August. And I believe the 28th of August, Mr. Perry sent a thank you email to the commissioners. And he actually put in the whole non-public session, and he thanked Commissioner Sorensen for calling him and giving him the information on August 22nd. And I brought it up the next day to the meeting because I thought it was strange. We didn't release the minutes yet, and the information is out to the public, to an employee. And when I brought it up, I had Commissioner Solomon, Sorensen, even Representative Babson said, no, everything was taken the week before in a public session. The motion was made, the vote was taken. But the tape revealed different. That was not true. It was not public. And the minutes today are still not released. But the employee had a whole non-public session.
Oh, good.
It's in the email.
I don't know that the employee had the whole non-public.
You got the same email. It went to all the commissioners.
I don't know that he had knowledge of everything that went on, but rather, certainly he was advised that there would be someone who would do the investigation. Beyond that, I don't believe anything was told. Anything else? Sir?
Commissioner Kenney, before you stated that you had received some 91A requests,
Yes,
do you have the dates when they were received by you with you now?
the 91, what I
The
mentioned
dates-
today?
Yes, the dates when they were
Oh, okay.
received.
I have October 3rd, 2012. And one is sent October 2nd, 2012. And I believe we have 5 business days to respond.
So there was only 2 then?
I actually have 3. Two is the same date, it's October 2012. One is October 2nd, 2012.
Just wanted to remind the commissioners that you do have 5 business
Yes.
days to answer that.
Yeah,
Thank you.
thank you.
Anything else? Mr. Brown?
Are there 2 sets of minutes? Because when you were reading here, what you were reading wasn't corresponding with the minutes that I have.
I know.
So there are 2 sets of minutes.
I have made a suggestion on the second set of minutes. It is up to Commissioner Kenney and Commissioner Sorensen as to what they want to do with that.
So you give your set to the public too?
I just read it.
Oh, okay.
Well, that's what I'm saying.
You're talking about a
No,
26.
she didn't give them to the public. 'Cause
Oh.
the minutes
Oh,
that I
okay.
have
Yeah,
don't
it's different. Oh,
correspond
okay,
with
I
what
got
was
it.
being
Yeah.
read.
Exactly.
Yeah, got
All
it.
right.
It's the
It's- I
26,
don't-
yeah.
I don't see how anybody, how you can do that, someone who's not even here at the meeting and rewriting the entire minute.
Well,
I don't think that can be done.
I have merely given an example of what could be done with the minutes to make them less cumbersome.
Well, it
I
should
used the
make-
camera, I watched it on film several times, and I made the changes. It is merely a suggestion.
Okay, so it's just a suggestion, because the camera's not an official record,
I understand that.
and you
I
can't
perfectly
use the camera to rewrite historic minutes of
I
something that's not an official
merely
record.
gave an
right.
example of how to write minutes that would not be as cumbersome as the ones we presently have. Anything
Well,
else?
I think Michelle Clancy is doing a wonderful job.
Anything else? Given that, I move to adjourn our meeting of October the 3rd.
9:39.
Thank you.
So no non-public today.
We have to take, it's a motion. Do you second the motion?
Well, you need to make the motion first.
I move to close the session of October the 3rd, and you
Okay.
gave the time.
I give you the time. 9:39. Second?
All in favor, say aye.
Aye.
Aye. Meeting adjourned.